Welcome to Ursuline College Wasonia Nurse Anesthesia Program webinar series. My name is Dr. Stephanie Woodruff, and I am the program director. Here today is Dr. Jess Hammond, who will be the assistant director of this program. Thanks for coming, Jess. So good to see you.
It's my pleasure.
So why don't you tell me a little bit about yourself and how long have you been a CRNA?
Well, I grew up on a dairy farm and my mother was an occupational therapist, and both of them greatly influenced me and developed my calling to care for others. I grew up going to the local hospital after school. I would wait for my mom to get off work. So I had a lot of volunteer experiences in healthcare. I graduated with my nursing degree from Washington State University and Whitworth University, and then worked in a cardiothoracic ICU at the University of Washington Medical Center for a few years before going to grad school. I became a CRNA in 2011, graduated with my MSNA and DNAP from Virginia Commonwealth University. I had the pleasure of staying there in Virginia for a while alongside those preceptors who helped train me before I moved back to my home state of Washington. I've enjoyed giving anesthesia in a level 1 trauma center, in outpatient surgeries, and currently in an independent practice that's heavy in obstetrics.
Wow.
I'm also the clinical coordinator for nurse anesthesia students, and I've been precepting students for my entire career. And I have a great love for education of them.
Well, it sounds it. Thanks, Jess. So from one CRNA to another, what's it really like being a nurse anesthetist?
Oh, it's rewarding.
Sure.
It's in any profession in healthcare, there's going to be challenging moments and tragedy. My mantra every day is to bring whatever good I have to the patient and to their situation. Our profession as CRNAs is to care for patients when they're most vulnerable, and so they're dependent on us. What I appreciate about this profession is the blend of art and science that I'm grateful I get to use my head to critically think, my heart to extend compassion, and my hands to literally touch people. It requires self-reflection and constant learning, and humility is just a case away, but it's very rewarding.
Oh, absolutely. For sure. So can you tell me a little bit about what exactly is a clinical coordinator and a preceptor for those who don't know what that is?
A clinical coordinator is the person that is a liaison for the facility and the school. And so they coordinate the schedule and make sure the student has what they need, and whether it be an orientation or the information, and pairs them with preceptors. A preceptor is the ideal relationship that I see for a preceptor is when a staff CRNA is like a coach to the nurse anesthesia resident. And they're there to encourage autonomous thinking, to support the learning of the student. They desire the success, providing feedback and advocating for clinical opportunities. Ultimately, a preceptor has the nurse anesthesia residents back. They keep them safe and they advocate for the patient.
Oh, absolutely. And what are your expectations as a preceptor, as a clinical coordinator, as the students progress through the program? So certainly your expectations will be different of a brand new student, first day of clinical, and a student right before they graduate.
Yeah, there are some differences as they grow, but ultimately for both, my expectation is that they make the most of their clinical experience. They're going to school, earning this degree, undertaking this training, which is a huge sacrifice in many ways, financially, socially, on their time, on their energy, and it includes long hours of studying, mental preparation, but the expectation is that they would put in the effort. So for first years, well, for both, I would expect eagerness. First years being prepared, setting up the machine and having the case ready to go, get there early, seek opportunities within the clinical setting that if the case is done for the day, that they might ask for, hey, can I jump in on that? Or I'd be willing to help with this, going above and showing that they're teachable and willing to learn. And then the second years, it's just more of the same. And hopefully their confidence and their ability to advocate for themselves in those clinical opportunities increases. Stay eager, ask questions, be curious, know everybody's names in the room.
That's important.
And be prepared. And when there's things that come up that they don't know the answers to, is to research it, review it, and follow up, so that there's that closed loop of education.
Yeah. And how do you think, how do they make the most of their clinical experience?
So by introducing themselves and knowing people's name, that is one barrier to overcome. And then after that, it's saying, hey, I'm here, I can help with IVs, or what do you need? That willingness and showing up.
Right. And if all their cases are done in the room, they can look at the schedule and see if there's any learner in the room, and hey, can I jump into that room? Is that okay? Of course, they have to check preceptor or clinical coordinator, but certainly just getting every experience that they could possibly get. Right.
Absolutely.
Yeah.
Absolutely. Not wasting this opportunity. This is your choice, and make the most out of this opportunity. My expectations is that students are diligent and vigilant, and that when they're CRNAs, they become confident, competent, and kind, and foster those qualities within clinical. And so being part of a team and putting yourself out there and welcoming those opportunities, even though it can be scary because it's new, it's worthwhile. And I'm in agreement with you about that.
Oh, sure. And certainly the students will face challenges, right? Because we're getting the best of the students in the ICU and putting them into this environment that they really don't know very much about. So what kind of challenges do you think they will face?
So the obvious challenges are that they're going to be around sick patients, or there might be tragic cases, acute crises that is unnerving when you're new and it's overwhelming. And luckily, your preceptor is there to support you. Poor communication can occur between staff if they don't know your role or what you're capable of. That it's not everybody remembers that you are RN and you had this experience of. So they just hear the word student, and it's just a learning thing and education. The other challenges are unfamiliarities with the clinical site, with personnel, and just the workflow of how things happen. There might be some disinterest or annoyance by staff members or patients or family members, and navigating that in a diplomatic and kind way can really benefit you and them. But those are definite challenges. And honestly, in all of those situations, attitude is everything. That you're not going to know all the answers. This is going to be a new experience, but your attitude will bring you success.
Like you said, it's a very humbling experience, right?
Yeah.
Very, extremely humbling. And what advice would you have for the student if they didn't get along with their preceptor, or they didn't understand what the preceptor was asking, or was frustrated?
I think that's a great opportunity for curiosity and questions, and coming up from like, oh, how could I learn from this? And I think if you can come with curiosity, that will diffuse defensiveness. And how can, you can ask the preceptor, how can I best do this? Or what would your suggestions be for me? And ask for that feedback. If you proactively ask for the feedback, then it won't come as criticism later on. And, there's always people that will advocate for you. And so if you're struggling with a preceptor, you have other mentors or faculty that can give you ideas and support you in that moment.
Or they can go to their clinical coordinator or their assistant director, right?
Absolutely. Absolutely.
So it sounds like you've been a preceptor for a while. So what are the most challenging experiences have you had as a preceptor?
Yeah. My challenge is the balance of letting students do the things their way and not intervening and showing them how I prefer to do it. And you're also balancing advocacy for the patient and meeting educational needs. So for example, maybe there's a difficult epidural placement, and balancing this is a good experience and troubleshooting through that, but also is the patient doing okay, and keeping an eye on both of those people.
Oh, for sure.
It's also, as I mentioned earlier, it can be challenging to accurately educate the support staff, the nursing staff, or other providers who interact with the nurse anesthesia resident. And, people forget that this is a nurse with the experience, and they hear the word student. So just educating and creating a positive environment for learning. I think it at the beginning it can be tricky, but once the morale's there and they understand what you do, it's really easy to overcome that part.
Sure. And how about your most rewarding experience?
Oh, my most rewarding experience, it wouldn't be a single moment in time, but collectively, I am just proud of how the students that I've interacted with, how they represent our profession, that I see the growth and the improvement in them and their increased confidence. And that is exceptionally rewarding to me.
Mhm. Oh, absolutely. Okay, last question. What advice do you have for students who want to become a nurse anesthetist and are planning on applying to nurse anesthesia schools?
Well, obviously, they have to obtain the requirements. So getting a BSN, becoming a nurse, getting good grades, having the critical care experience with your CCRN. I also recommend volunteering. That is a way that you can be exposed to environments and foster your growth as a provider or future provider. If you work extra, that can only benefit you from the financial standpoint and your experience. It's a way to save money, work extra, save money, and minimize your student debt. But it's a mindset, knowing that you're a volunteer of this, that if you choose to become a CRNA and get that training, that that choice is so rewarding. And just keeping the attitude that you're not going to waste this opportunity, even though it can be hard. That would be my advice.
Thank you so much. You really, it's being a nurse anesthetist is one of the most rewarding things in my life, besides my family. And I really, really appreciate you coming in and telling whoever wants to hear about being a preceptor, about being a clinical coordinator, about applying to school. And thank you so much. I look forward to the fall.